Well, a big day is coming up on June the 6th. That's when the Mission Act, the VA Mission Act, goes live. So what's that going to be meaning, Paul, to the veterans here in the state of Montana, where we have close to 100,000 of them?
Well, the overall goal of the Mission Act is to allow us to provide a better experience for our patients that rely on us for our health care services. In most places around the country and here in Montana with the VA, we have what's known as an integrated delivery system where we have everything from primary care, specialty care, inpatient care, and nursing home services. The amount of services that we offer and the connectedness of those services give us an advantage, but we also rely on the community for those healthcare services. And the overall goal is to provide more options for veterans so they can get the right care at the right time and right place.
Now, the VA of Montana is having listening groups, town hall meetings throughout the whole state of Montana. There's one in Billings today. Let's talk to the folks what they're going to hear at these meetings.
Well, the most important thing, we have our first ones today are these town hall engagements. Veterans are receiving a letter that details the changes of the Mission Act. But we are augmenting those nationally distributed letters with these local engagements. And these are town halls aimed to provide the most important aspects of the changes that they can expect to see.
Now, the VA Mission Act was enacted by Congress and the Senate last June 2018. It's been 1 year until it goes live. What's been going on in this past year to fine-tune things?
Well, there's been several aspects that have gone on nationally, and local efforts have really ramped up within the past 60 days. But some of the big changes that have been planned have been going on. They've been calculated and basically rolled out time for review of these to make sure that they meet the needs of patients around the country, and the changes are the best for veterans to get the right care at the right time. But two of the biggest changes that have been calculated over the time have been the changes to the access standards and the drive time standards for veterans to have the option to receive care from a contracted non-VA provider.
And something that we should tell the veterans, okay, this is a brand new plan. It's been tweaked this last year, goes live on June 6th, to have a little patience, because whenever you have a new thing happening and everything, there's always a couple bumps in the road. So how are you guys going to deal with those bumps in the road?
Well, we've started heavily training our staff over the past month, but one of the biggest things that we've developed, that's been developed nationally for us, but our providers are going to have access to it as they interact with our patients, is the Decision Support Tool. The Decision Support Tool is a software program that our clinicians are going to have available as they meet with patients or as they order additional services for patients, and it will tell them what their eligibility is for non-VA care options if they qualify for them.
Since this is going live on June the 6th, does the VA boost up workers to be in different areas when this goes live?
So around the country, some of the things that are happening, we've had trainings that have happened. We've had a pilot that Montana benefited from to prepare for this. We've had additional resources from our IT to prepare for the use of this tool. But some of the cool things about the actual Mission Act are the additional resources and strengthening of our internal operations. We're getting increased recruitment incentives, increased authority to provide for educational and debt reduction incentives for new providers that want to work with the VA, but also additional resources to serve veterans in underserved areas. Something else, as far as resources to help strengthen the amount of options that we can provide veterans, we have a new third-party administrator that's responsible for contracting with community providers in the state. They've started in Montana within the past 6 months, and they're building their network so more Montana veterans have the option to receive services in different locations around the state.
And that was one of the big complaints that went through this third party, and I think at the time the third party was down in Florida, whatever, and the veterans were upset, doctors weren't getting reimbursed. This is a big switch and a positive switch.
Agree completely. We want to strengthen what we do internally. We want to give veterans more options, but the VA has to be a better partner if community providers and healthcare organizations are going to partner with us to serve our nation's veterans. The new third-party administrator in the area, Tri-West, has been very aggressive in building the network, even offering a new benefit of the Mission Act, which is the urgent care services that are going to be available as part of the Mission Act.
So what do you think is the biggest change right off the bat that the veteran that uses the VA is going to see?
I think the biggest change for Montana veterans in particular are two-pronged. First of all, with the new eligibility requirements, with the access standards, they're changing for 20 days. If we can't get a veteran seen within 20 days for their primary care or their mental health appointment, or 28 days for their specialty care appointment, they have the option to go to a contracted non-VA provider. For the distance factors for the eligibility, it's a change from distance to average drive time over the previous year. If a veteran's average drive time from the previous year is greater than 30 minutes from primary care or mental health appointments, or 60 minutes for their specialty care appointment, they have the same eligibility options to see a contracted non-VA provider. In addition, something specific for Montana veterans, if they maintain their same permanent residence that they had through the Choice program, which was 40 miles from the nearest VA, they maintain that same eligibility indefinitely. Other states, I think 45 of the other 50 states in the nation, they don't have that same eligibility options, but Montana veterans maintain that eligibility indefinitely.
Now, Paul, one of the big things, I've talked to Senator Tester about this and that, is mental health care. And this new act, is that going to be spotlighted a little bit more than what it has been in the past?
I think from a couple of perspectives where mental health is going to be targeted. First, we're going to have increased authorities to recruit providers through the programs that I mentioned earlier with recruitment incentives. Additionally, there's going to be programs where specific medical schools, through specific medical schools, where we're going to be able to pay for the students' medical schools for their commitment to work 4 years at a VA medical center or clinic. Additionally, there's programs within the Mission Act that will allow for additional peer support services. Peer support services are relatively new within the VA, but veterans love them. It helps them interact more with their peers, which is one of the strengths with coming to receive health care at VA medical centers. But these services, they're usually utilized strongly in our mental health departments, so they specifically will target there. And finally, there's also strengthening of our telehealth resources with new equipment, increased boundaries for patients to see providers in different states through telehealth if there aren't good mental health options available in the community where veterans live.
Let's talk about telehealth a little bit. I have a friend who's a Korean veteran, and I think it was 3 months ago or so, he went to the VA and he saw his doctor. She was in Bozeman, and he thought it was the neatest thing that he could sit there. And, of course, they had a nurse in the room and everything, but talk to a doctor that's, 150 miles away, and, he liked it.
Our Secretary, Robert Wilkie, really believes in telehealth. The VA is an unquestioned leader in the advancement of telehealth, and it's critical in states like Montana with highly rural populations connecting, and specifically with the Mission Act. There's been barriers in some states for providers to see patients in other states. The Mission Act helps to remove those barriers and also increase competencies for our providers for telehealth providing services, because you can't just throw a provider on the conference with a patient. They have to have specific training for that. I also want to do a plug for our VA Video Connect. That's something that we've been investing heavily over the past year, where patients can dial in over their cell phone and have a video conference with a provider. That's something that we've been increasing our providers' competency in, and we're increasing our workload in that as well. It's just another option to help patients get quicker care and in the right place in the right time.
Paul, there's going to be a lot of questions. People are going to have questions about this Mission Act. What website can they go to, and is there a toll-free number available for our veterans out there?
Yes, the first number that I can provide to you is, or first a resource that the veterans have is missionact.va.gov. They can find that through the va.gov website. The best place that I can give right now for our patients in the state of Montana is our local 800 number, or is our 800 number that they can reach around the state, 877-468-8387. or 406-442-6410. But the missionact.va.gov website and the va.gov website, that's going to be key resources for veterans to find community providers that are contracted with the VA, specifically for things like the new urgent care option as well, too.